So it gives me great pleasure to introduce Dr. Sohère Roked, apologies. And we are going to be talking all about balancing your hormones because Dr. Sohère really is one of the leading experts in this space. She has so many fascinating things to say on this topic. And I know we don't have long, so I'm going to jump straight into it. And the big question we always get asked at the Tweakments Guide is, should I be balancing my hormones? What is hormone balancing? Oh my goodness, I think I need to know something about hormones. So starting right there, what are we talking about when we're talking about balancing our hormones?
So, of course, I'm slightly biased, so I will be saying, yes, you should be balancing your hormones, of course, but I can back that up. So the thing is, we all want to look good, but it was also about feeling good and feeling optimum in ourselves. And really, our hormones play a huge part in that. So, obviously, if you're perimenopausal or menopausal, that has a huge impact on your energy, your mood, your sleep, hot flushes, concentration, focus. And if you're not sleeping well, you're not going to look your best. Your collagen goes down as your estrogen goes down, as people who are all interested in how we look. So, that's an important thing to know as well. But obviously, if you feel well in yourself, then that's one thing as well. Some people just want to get things checked to be optimum, but other people feel like, actually, I'm not sure this is an area where I need to be concerned at the moment. And then there are just so many other facets to your health that you can explore as well. I also look at things like gut health, vitamin and mineral testing, looking at the stress hormones. So it really is like multifactorial in terms of getting things in balance.
And of course, we're at an event called the Tweakments Guide Live. So there might be people in the audience going, I'm here to talk about treatments. Why are we talking about hormones? And you did touch on it, obviously, a little bit in your answer, but I'd love to know why this topic, which is being discussed more and more in the aesthetics realm, why is it important to be having this discussion for the best results and also, as you say, for looking and feeling good?
Yeah, so one of the things that I like to sort of practice and talk about is that inside-out health approach. So we obviously want to look good on the outside, but it's all very well looking good if you feel terrible on the inside. You're not getting the best out of your health and life and all the things you want to do. I did touch on it earlier. Collagen goes down as estrogen declines. And that's just a fact. We need estrogen to make that. And of course, you can take supplements and things like that. But say, for example, if you were looking at having some tweakments done, by balancing your hormones first and maybe getting your estrogen a little bit more optimum, and also progesterone is really important for the skin, that would mean that the treatments that you're paying a lot of money for have a lot more benefits. So I think there really is the tie in there. And I think so much more, there's a tie with aesthetics to be a bit more holistic as well and not just focus on the outside, but try and figure what's going on the inside as well.
Do you have any advice for people here who might not know whether they need to balance their hormones? Are there any signs or symptoms that they need to be looking out for? Or is it equally that you would recommend that any woman of any age or a particular age might want to get them checked?
Sure. I mean, we have a plethora of choices of things we can get checked and looked at and treated these days, right? So I think it's all about, obviously, if you're in menopause and you are having troublesome symptoms, that could be a sign that that's something you'd like to have a look at. Equally with the perimenopause, if you're noticing, maybe you're in your 40s and your cycle's changing, you're not feeling as good, that could be a time to get things looked at. But I always say you need to become the expert in yourself. You need to be saying, is my sleep off for me? Is my mood off for me? Am I a bit foggy? My focus isn't so good for me. And you use yourself as the barometer in which you measure yourself, essentially. And then if you can do that and you're noticing, well, actually, there's like 5 or 6 key areas. I don't feel my hair and skin looks as good. I'm tired all the time. My mood's not good. I'm snappy. I can't remember things. Maybe we need to get something looked at then because you're clearly not quite your optimum self.
And so it's all about sort of a personalised approach.
Yeah.
So we've talked a lot about sort of why hormone balancing might be a good idea. How does someone go about doing that? What are the approaches? And maybe you could talk people through step by step what you'd advise in order for people to get the help that they might need.
Sure. So what I do is individualized and personalized, but I can give you some like rough guidelines of the sort of approach that I would take. So if someone was having a cycle, it's different if your periods have stopped completely. So if you're having a cycle, I'd want to take quite an in-depth history of what's happening at different times of your cycle. And I probably would want to do some hormone testing so I can look for the balance between the key hormones at a certain point in your cycle. And then based on that, I would make a treatment plan for you. And that might be taking some estrogen. If you're having a regular period, most of the women I see actually aren't on estrogen. They take progesterone, which is not the same as synthetic progestin, which is a big bugbear for me. It's actually very good for things like your mood and your sleep, your energy, your weight, whereas synthetic progestin kind of does the opposite of all of that. And I also prescribe a lot of testosterone for women, not so much that you become hairy or spotty or aggressive, because we don't want that, but just enough that it's good for your energy, your mood, and it's really great for your brain fog. We always think of testosterone as just about sex drive, but it isn't. It's also about being on form, being motivated, having get up and go. So I look at those hormones, and there are a few other things I look at as well, including cortisol, gut health quite commonly as well. If you haven't had a period for, say, at least 6 months, I'm not going to start with hormone testing. Seems like a bit of a waste of your money. What I would do is start you on something and then do the testing 2 or 3 months later so I can optimize what you're taking. So it's more of an individualized approach according to what's going on in that person's circumstances, but also according to their symptoms.
That makes a lot of sense. And there's a big kind of discussion point in this area of the industry about sort of bioidentical and body identical hormones. And frankly, I won't lie, I get these confused all the time. I stumble over them, and I work in the industry. So I would love to know, once for all, in a bit of a nutshell, what is the difference? Is one better than the other, or is it again about a personalized approach? And what is your recommendation?
Sure, so that's a great question, because I think a lot of people feel confused by it, including some doctors actually. So it is important to clarify that. So in terms of hormones, we have three types of hormones. There's synthetic, which is basically drugs with some hormonal properties, which I'm not the biggest fan of, but they are still prescribed. And then there's body and bioidentical. So both body and bioidentical hormones have the same chemical structure as the hormones your body is producing or used to be producing. Body identical are made by a drug company, and bioidentical are not. They are custom made, still by a pharmacy, but not by a drug company. So in terms of body identical hormones, that's what you might be able to get from your GP. And they come in standardized doses. So there's a progesterone tablet, there's a gel for estrogen, some of the patches, and some tablets as well for estrogen. But say if you start taking those and you have a problem, the dose isn't quite right for you, you can't tolerate the form it's in, then your GP doesn't have anywhere to go with that. So then if someone was seeing me, because I prescribe both, I would then look at the bioidentical route. So I do prescribe both. I think both are good. I don't see there's any reason to take something that's bioidentical if you're responding well to the body identical. The key thing that I do, of course, is the testing, which your GP doesn't. So I like to monitor my patients at least annually once they're stable, check their levels, make sure everything's optimum, do general health checks as well, because otherwise you can just be put on hormones and you're left on them for 10 years plus and told to get on with it. Because I think things change as your body changes, as your life changes, as your health changes, and it's that monitoring that I think is really important as well.
You neatly go on to my next question, which is, we talk about balancing them, but I assume, things change over time. So how often should we be thinking about our hormones in general, and how often should we perhaps be seeing someone? Or I slightly predict your answer is it's going to be very personalized, but I'd love to know your thoughts.
It is personalized. Once my patients are stable, I normally see them about once a year and do some blood screening or some other sort of testing and make sure they're up to date on things like mammograms and pelvic scans and things like that as well. In terms of, say, if you're not on hormones and you're just wondering in general, how often should I be getting my hormones checked? So I think it could be a great idea to do it while you feel healthy and well, because then we have a baseline of when you felt well to compare to. I personally get my hormones checked about twice a year, but obviously I'm really into hormones, so that's explanatory really. I'd say maybe, if there's no problems, maybe once a year or once every 2 years. Once someone's on hormones, I like to do yearly screening at least.
And then my final question, because it does come up when it comes to some things, what are we talking about when it comes to costings? And what can we do in order to basically, for want of a better expression, which is not coming to me, how do we get our bang for our buck?
So I always say to patients, I think this is the most cost-effective option. That's the thing I look at. So, there is a range of different things you can do. The bioidentical custom-made hormones are more expensive. So obviously, if someone's starting on them, we need to be mindful of the long-term costs, because unlike some aesthetic treatments, it's something you're going to be having on a continuous monthly basis, whereas I know certain treatments you might have once a year, or certain things once every few months, so it's not necessarily the same outlay all at the same time. But yeah, look, there's different things for different budgets, and I will always try to work within someone's budget. The blood testing can be quite expensive privately, but now there's companies like Medichecks and Randox and Thriva that are a lot more cost effective as well. So there are options if someone's looking at it long term.
Well, thank you so much for talking to me. As always, and with all our practitioners, Dr. Sohère will be around, so do grab her if you have any other questions, especially perhaps more personalised, and see her in clinic if you have any further questions. But thank you so very much.
Thank you.